Hi, this is Jeff Geske here with the Fits on the Go blog. The great pleasure of interviewing Dr. O'Gara, who's the ACC President. Dr. O'Gara, thanks so much for joining us.
Well, thanks, Jeff. Always great to be here with you guys.
Well, how has your year gone so far as the ACC President?
I think it's been a terrific year. I'm really looking forward to the last half of the year. It goes by very quickly. There are a lot of major issues with which the college is currently engaged, ranging from maintenance of certification, which affects some of our older members, certainly not you yet, but it will affect you and your FIT colleagues within the next 10 years for sure. And the conversations around what is defined by the word professionalism, the college's commitment to lifelong learning, and trying to recalibrate the process by which recertification is granted. So that's been an issue. I think other issues that are facing the college is really how is it that we can most effectively execute our strategic plan. And I know that sounds like kind of an ambiguous concept for our FIT colleagues, but we're engaged in some conversations about how best to allocate members of the workforce in helping to close the gap with respect to the number of expert providers available to deliver cardiovascular care and the epidemic of cardiovascular disease that we're anticipating, partly on the basis of the fact that our population is getting older, and also on the basis of the fact that some of our medical treatments are extending life, and our patients are developing subsequent problems that had not been anticipated during the earlier phases of attempts to provide appropriate intervention. And then lastly, I'll leave you with the sense that the college is actively engaged in some discussions around what is the meaning of population health. So you and I in our daily lives generally aspire to provide an individual patient with the best possible outcome and to close the transaction and the responsibility we feel in doing that. But we're also now being held to a certain level of responsibility with respect to the populations of patients that we care for, such as a population of people with diabetes, a population of people with hyperlipidemia and hypertension, or a population of people who are in your accountable care organization. So your performance is measured in a group whole and not so much as an individual. What can we do to help our members negotiate and navigate this space where we're now responsible for looking at an aggregate number of patients? And then we're going to extend that with respect to trying to define what the ACC role should be in discussions around public health, prevention, and the promotion of cardiovascular wellness.
Wow, fantastic. It sure sounds like there's a lot going on. Can you tell me what ACC's role is here at ESC in Barcelona?
Well, great question, Jeff. Firstly, many of our members are here presenting research or being asked to participate in plenary lectures with respect to the science that ESC has identified in their meeting. And the ACC and the ESC have an agreement by which the chair of our Scientific Sessions Program Committee is a member of their program committee. So there's an interchange of ideas between ESC and ACC with respect to scientific topics and also with respect to speakers who would be able to participate actively and provide an added value. And we very much appreciate our relationship with the ESC. Most of us come here to learn about the application of new technologies because, as you know, the United States is generally a few years behind our European colleagues with respect to application of transcatheter therapies, for example, and also with respect to certain classes of medications. And lastly, the announcement of late-breaking clinical trials, and that has now become a global initiative. This is not something that's specific to the ACC or to the AHA or to the ESC. Late-breaking clinical trials become due at regular intervals when the data lock is set, and one-year follow-up can be provided. And this year, as you know, we're very anxious to hear the results of something like the Paradigm study, which is looking at a new class of molecules for treatment of patients with systolic heart failure. Those are some of the things that I would highlight.
That's fantastic. You know, with all this interesting science, with these national meetings, with the initiatives that you described that the ACC is pursuing, what can fellows do to become more involved?
Well, I'm glad you asked the question. The first piece of advice that I would like to give is to stay engaged. I think that this is the opportunity across the history of the college for fellows in training and for early career individuals to have an impact on where the college should be going over the next 5 to 10 years. So we are actively paying attention to the aspirations and needs of our fellows and early career individuals. One area that I would emphasize is our strong desire to create opportunities for funding for research which could be basic, translational, population, research that could be done through our registries around quality and outcomes. We recognize that we have a responsibility to help our fellows and early career individuals during a very vulnerable phase of their maturation and during a time when money is tight. That we wish to identify that we can help them acquire the funding necessary to be successful. I think what fellows can do and fellows in training can do is to continue to ask questions, to push us, to provide the kind of educational materials and research opportunities and mentoring opportunities that you think you need to be successful in your career.
Wonderful. Well, thank you again for joining us. This is Jeff Geske with the Fits on the Go blog. You can check out more videos at youtube.com/fitsonthego.